Hi, my name is Megan Steffes,
I'm Olivia.
I'm Shay Sams.
and our project is on changing a sterile dressing. So, to start, why do we need some dressings to be sterile? The main thing is that we are preventing bacteria from entering the wound bed. And this essentially prevents infection that would otherwise delay the wound healing, but has also been shown to decrease the overall time of healing. What kind of wounds need to be sterile? Typically, surgical wounds would expose the inner body cavities that would increase the risk of infection. Along with that, traumatic wounds also need to be sterile due to their pre exposure to debris and other bacteria during the traumatic incident. The most important wound that can apply to both of these would be open wounds. We want to keep any bacteria out of the body and the wound bed, which requires covering open wounds with sterile dressing to promote the growth of healthy tissue and inhibit infection from the outside environment. Starting with step one, what do you need? Some things that you would need are disposable gloves that will be used to remove the old dressing. This does not need to be sterile because we are removing the soiled dressing that is already not sterile and soiled. You will also need sterile gloves for when you are applying dressing as to maintain sterility. When cleansing the wound, you will also need sterile water. There is also antimicrobial agents that are used for postoperative care that are associated with decreased infection and faster healing. As for new dressings, this definitely depends on the wound, the provider, and the resources that are available at your facility. Examples of wound care supplies are gauze, which varies in size and how absorbent they are. There's also non adherent dressings that are meant to sit on the wound without sticking to the delicate healing skin below. These would typically be used for burns and skin grafts. There is also hydrocolloid dressing, which promotes a moist environment that won't damage the wound when you're removing the dressing later. There is also alginate dressings that absorbs the exudate or the drainage and forms a gel with the wound when it's in contact. Similar to those are foam dressings, which are meant to absorb larger amounts of exudate for wounds that are relatively fresh in the healing process. For wounds that are at high risk of infection, such as trauma wounds, silver impregnated dressings have antimicrobial properties that can be used for someone who has a high risk of infection, such as a diabetic patient. Lastly, collagen dressings are used to promote healing, and transparent dressings are honestly great for monitoring the wound bed so that we don't have to remove the dressing all the time to check in on the wound healing process.
So, when you go to remove the old dressing, you first want to wash your hands and apply non sterile gloves. After the gloves are applied, you may need to use normal saline solution to help with the removal and to preserve patient skin integrity and just make it easier. Then, after the wound dressing has been removed, you're going to dispose it into a separate clinical waste bin. When the dressing is off, you're going to want to make note of the color, smell, drainage, and size of the wound.
So once you've removed the soiled dressing and you've taken off and removed your gloves, you're going to want to wash your hands. And now is at the point where we're going to want to apply sterile gloves. So if at any point while you're cleaning the wound, you notice that your gloves have become desterilized, you want to remove and reglove. And when you're cleaning the wound, you're going to want to start from the bed or the most dirty site on the wound, which is usually the center, and move toward the outside or the more clean area on the skin. This is just to avoid introducing any more bacteria to the skin that's trying really hard to heal. If your swabs or the gauze you're using to clean the wound become saturated or they look overused, just get a new one so that you're avoiding contaminating the newly cleaned area. And remember while cleaning the wound that you want to be intentional about the pressure and the motion that you're using to clean because the skin is most likely tender and it will also help avoid disrupting the newly grown tissue.
When you apply the new dressing, you want to make sure you're using the appropriate dressing type for the wound. As mentioned earlier, there are many different wound types and wound dressings that will allow for the best healing. Sterile wound care is going to be ordered by the provider, and these orders will often include the type of dressing and how often you change it. So you want to be sure to follow these orders when completing your cares. When you're applying the dressing, you want to make sure that all of the wound is accounted for. If there's any tunneling, be sure to pack it and then make sure you cover over the surface of the wound. After the wound is covered, you're going to want to label and tape off the dressing. This allows for easy and clear information on when the dressing was changed and when it should be changed next.
So now that your wound has been cleaned and redressed and you've cleaned up all your supplies, this is the time that you would want to provide education to the patient just regarding how to manage their wound. And this could even include giving a handout to help guide on cleaning and redressing if it was absolutely needed. And also, this would include what signs or symptoms that they would need to note and then report to a healthcare professional. So after patient care and education, you're going to want to go in and note and document any pertinent or abnormal data about the wound. Some things this could include would be the size and type of dressing applied, how the wound was cleaned, the noted color and wound bed and of the wound bed and surrounding skin, and also the dimensions of the wound. Other things could include odor, their medical history, such as are they a diabetic? This could affect the way that their skin heals, and then drainage or tunneling and regression.
Thank you guys so much for listening, and I hope you guys learned a lot about changing sterile dressing.